Hi, I'm Margaret Kapasi, Nurse Practitioner with Free Spirit Aesthetics, and today I'm going to show you how to draw up your peptides. Step one, after your peptides have been reconstituted, is to clean off the top of the peptide cap. So you've got your little rubber stopper there inside the metal. You just want to wipe it with alcohol to make sure it's nice and clean. You'll remove the guard from the plunger at the back of the syringe, and then you'll remove the cap from the needle. As you can see, the needle is tiny. You can barely see it. You probably can't see it in the video. Loosen the plunger a little bit to make sure that it slides easily when you're drawing up your peptides. Turn the peptide vial over. Look for the circle in the middle of the rubber stopper and try to stick the needle as close to the middle of the circle as possible. The middle of the circle is going to be the thinnest part to make it easiest to get the needle in. And then you just go ahead and pull the plunger back past the 10 or whatever your dose happens to be. For most peptides, the dose is going to be 10, but please do review your instructions because that's not the case for every single one. And then you push the stopper back in until the black portion of the stopper that is closest to the needle is at the 10. And you're gonna just pull it out, and if you're ready to inject, you can go ahead and inject. If not, then you can replace the cap over the needle and place it in the refrigerator until you're ready to inject. Now we're gonna talk about how to inject your peptides. Either you've just pulled up a syringe, or maybe you had some syringes in your refrigerator and you've pulled out your syringe and now you're ready to inject. The first step is going to be to choose a spot on your abdomen, at least 1 inch away from your belly button, but anywhere on your flanks, above or below the belly button is fine, as long as you stay 1 inch away from your belly button. Once you've chosen your spot, you're going to take some alcohol and wipe that spot with the alcohol. Then you'll pull your cap off. Hold your syringe like a dart. One key thing to remember is don't put your finger above the plunger when you're about to inject. Keep your finger on the barrel of the syringe like a dart, because you don't want to accidentally push your peptide out before you've actually got the needle in your skin. Then you're just going to pinch up your skin and poke that syringe in straight in, just like a dart. Once the needle is all the way in, so you want to get the needle completely into your skin, all the way to the barrel, so you poke all the way. Then move your finger onto the plunger and depress the plunger all the way down. At that point, count to 6 before you pull the needle out to make sure that all of your peptide gets into your tissue and doesn't leak out. And then you can remove your needle and throw it away. Lastly, we're going to talk about how to dispose of the needles. Once you've finished injecting, you need to place your needle into a hard-sided plastic container with a lid. Just continue putting needles in until that container is filled up. Once it's full, put the lid on, tape it up with duct tape or some other sturdy tape, and label it Sharps. And then you can place it in the trash. Alternatively, you can purchase a Sharps container from any retailer and use that until you've filled it up.
Margaret, what's an example of a hard container with a lid?
That could be anything like a peanut butter jar or a detergent bottle, anything that's just hard plastic and can have a lid that closes.
Perfect.